Welcome to the Critical Care Unit at Liverpool University Hospitals. You're about to watch a short video which will give an informative insight into what you can expect to experience when visiting your family or friends on the unit at either Aintree or at the Royal. When a patient is transferred to the Critical Care Unit following their surgery, they will be nursed for a short period of time before being transferred to a ward as part of their enhanced recovery pathway. Our primary responsibility is to provide safe and high quality care following an operation to support patients, families and friends throughout their admission. The Critical Care Unit at Aintree is situated on the first floor in the main hospital. The unit has two separate entrances, one for patients and staff and one for relatives and friends. At the Royal, critical care is split between three separate areas. The intensive therapy unit is on the first floor, the high dependency unit is on the 8th floor and the post-operative critical care unit is on the 11th floor. It is important to check which unit your relative can be found prior to visiting. From the main entrance, proceed to the left of the hall and take the lift or stairs to the appropriate floor. Visiting times to our critical care unit may sometimes be restricted to prevent the spread of infection in our hospitals. Our staff are happy to speak to relatives and friends to discuss visiting arrangements and keep patients in contact with their loved ones. Depending on circumstances, visiting hours can be more flexible, but please note that unfortunately we don't routinely allow children under the age of 16 onto our units, either at Aintree or the Royal. At Aintree, one of the first parts of the critical care unit that a visitor will see is the relatives room. Here you will find a notice board with advice and information to help ease any worries you may have about your family member or friend on the unit. Once entering the reception area in the critical care unit at the Royal, visitors are greeted by the ward clerk. If the ward clerk is not available, there is an intercom which connects to the nurse's station. A nurse will then meet the visitor and take them to the patient's bedside. It is not unusual for visitors to be kept waiting before they visit the units. This is often due to various members of the critical care team carrying out various interventions and procedures or ward rounds taking place. We currently have a strict policy of one visitor to a bed space at one time unless otherwise advised. At Liverpool University Hospitals, we work very hard to prevent any cross-infection, so we encourage all visitors to use the alcohol gel on their hands before entering and leaving the unit. If any visitors have been suffering from a cold or cough or have had any diarrhoea and vomiting, then please delay your visit until you have no further symptoms. To help stop the spread of COVID-19, hospital visits can be significantly limited, so you're advised to visit the hospital website for advice and any additional information. If you are visiting a patient in the hospital, you must wear a face mask covering your nose and mouth. When a patient is transferred to a bed space in critical care, they will often have a face mask or breathing tube attached to oxygen to help their breathing, along with various lines and drips which help monitor their condition. These can be temporary and will be removed when no longer needed. The various machines, monitors and alarms can make the patient's bedside a little noisy, but this is quite normal for the critical care environment. A patient's care will be delivered by a team of highly skilled professionals that include nursing staff, physiotherapists, doctors and other members of the multidisciplinary team. For planned surgery at the Liverpool University Hospitals, we follow an enhanced recovery programme to get our patients home quicker after their operation. This will have already been discussed with patients at their pre-op visit. It will mean that on the first day following their operation, they will be expected to sit out of bed and assisted to walk within the unit. This is aimed at preventing various post-operative complications that are linked to staying in bed too long. At Aintree, we have an external balcony space that can give patients a much needed taste of fresh air. When a patient is discharged from critical care, they are followed up by our critical care outreach team who can highlight any concerns that may arise. They review the patient on the ward the day after discharge from critical care and then every day until they are no longer required. The patient has the option of receiving their patient diary detailing their stay on the critical care unit. On the ward, the environment is different to critical care, and this includes nursing ratios. This is all explained by the outreach team, and a step-down booklet is provided for the patient which explains post-critical care treatment. On discharge from hospital, patients are invited to a follow-up clinic approximately 8 weeks after discharge. At this clinic, a patient's clinical and emotional status can be reviewed and a psychology referral can be done if required. This service is all part of the patient's journey and aims to offer additional support and care post-critical care. If you think it would be helpful to arrange a visit prior to your operation, please feel free to contact us. We are proud of the care we give here at Liverpool University Hospitals, and here are just a few of the kind messages of appreciation and thanks forwarded to our team from some of our patients and their families.